Welcome to this episode of Today I'm going a bit casual to talk about something I really enjoy doing that also has incredible health benefits and should be considered of import for improving the health of populations. I really enjoy getting outdoors, whether on or near the water, or if I'm going backpacking, camping, or hiking. Each of these activities takes me out into nature and just makes me feel good. This feeling is backed up by numerous studies showing various health benefits from participating in these types of activities. Shinrin Yoku, or forest bathing, is a Japanese term to describe the therapeutic act of spending time in nature. Japanese doctors promote this as a way to relax and get away from a hectic urban life. Numerous studies have found positive effects on human health by getting out into nature, including one entitled Effective Forest Bathing, Shinrin Yoku on Human Health, a review of the literature by King Lee. In it, he discusses establishing a new interdisciplinary science called forest medicine, belonging to the categories of alternative medicine, environmental medicine, and preventive medicine, which encompasses the effects of forest environments on human health. Another study by Matthew P. White et al., entitled Spending at Least 120 Minutes a Week in Nature, is associated with good health and well being and was also published in 2019. This was a study of 19,806 participants. The analyses, and I'll quote, controlled for residential green space and other neighborhood and individual factors. The pattern was consistent across key groups, including older adults and those with long term health issues. It did not matter how 120 minutes of contact a week was achieved, for example, one long visit versus several shorter visits per week, and compared to no nature contact last week, the likelihood of reporting good health or high well-being became significantly greater with contact that was greater than or equal to 120 minutes, end quote. Forest bathing has also been shown to reduce the scores for anxiety, depression, anger, fatigue, and confusion, and increase the scores for vigor, showing psychological effects as well. Now, being near on the water, known as blue spaces, provides similar health effects, and in particular, they can be more of a mindfulness type activity. I find that when I am out on or near the water and either enjoying a water sport or fishing, it is very similar to when I am doing a structured mindfulness activity. Other studies have shown that spending time in blue spaces lowers the risk of stress, anxiety, obesity, cardiovascular disease, and premature death. The positive effects of being in nature on our health raises some interesting questions, particularly for those who live in communities in which there are no green or blue spaces. How do we help them? Many cities have focused on creating parks and other preserves where individuals can get access to these green or blue spaces. Others, such as Big City Mountaineers, a not for profit founded by a friend of mine, has created programs for youth from disinvested communities to get out into nature. Each of these examples are ways we can create environments for individuals to access these important and healthful spaces. I hope you can experience the benefits of Shinrin Yoku or blue spaces, and as a healthcare practitioner or someone else involved in the healthcare system, think about how you can assist and support efforts to increase the availability of these activities for others. Thanks so much for joining me this week, and I hope in the coming week you can get outside to enjoy nature as I will. If you'd like to speak with us about this or other areas of population health, contact us at info@accountablehealthllc.com.